This is a sizer, this is a sample implant. The whole purpose of a sizer is to kind of see how things will look before putting in the actual implant. Because when we open an actual implant, it has to be done in a very sterile fashion, very carefully. It's only one-time use. The sizer is kind of like our tester. We put it in, we see how things look, and we can make changes to the pocket, we can make changes within the surgery, but once we pick the actual implant, we have to do that very swiftly because we don't want to risk any type of complications. Sizers, just like implants, it has a silicone shell. It also has a silicone gel inside. So it very much acts and feels like an implant. Because these are used more often than an implant, they sort of have a certain shelf life. They really can only be used for 10 cases, and then I'd have to purchase a new sizer. They're also not made to be implanted or to act as a permanent device. So you may be wondering, where do I use sizers? Sometimes I don't need them. If I preoperatively know the size and what the patient wants, I can go straight to the implant. But there are certain situations like revision cases, breast augmentation, breast reconstruction, where we do use sizers because it's a little bit trickier and we want to make sure we pick the correct size before we open the actual implant. Everything I do in the operating room is sterile, so sizers are actually sterilized. Implants themselves come sterile in their original packaging, so they get taken out, handled in a very sterile manner with minimal manipulation. It's put where it belongs and things are closed. That's to prevent infection, capsular contracture.